We allow that. So now sometimes you put a PPT and they are also searching the same PPT. This is a common thing what they read. And it is a human being when you know if something is available somewhere else and you know somebody has taken and teaching you, your acceptance is very low for that. Something coming to pure. So here these are common things, SGD, SDL I told you, DFP, simulations are coming in a big way. Role playing is a part which we use a lot, video clips. But overall if you see typical lecture setup, you might be amazed from BC till now there is not much change. The way we take lectures. Okay? So you see all these diagrams they are saying 400 BC, 1960, 2019. Lecture has the same type of thing set up. It is you people who can innovate within that. We will talk about some of that. So now we talk of teaching learning methods. They are based on domain or group size or the context. We are taking examples for them. Domain is 3 domains. You are aware of that. So I'm not going into details of that. Cognitive, psychomotor, affective, and some examples we have seen, and we're just putting them into that. Totally, purely knowledge based, which you have, psychomotor, which you have, and you will see affective domain is very important. When you teach, which is your major focus of them, which is percentage, where you invest more, first column, middle column, or the last column. Should be ideal is something different. What you presently do, or in your department or something. Which are the main heavy part? Affective role plays, demonstration. Cognitive lectures, which is knowledge heavy. Knowledge heavy. Affective is where you tell them okay, how to behave, how to talk, all those components. Research says most of the faculty feel comfortable at the first one. So teaching, learning also, and assessment also. Yeah. So even if you see your theory question papers, which is common verb used in most of the questions. What, why, how, explain, discuss, elaborate. Discuss, just hold on, I'm coming back to that. So it means most of, are you aware of the knowledge domain has 6 levels? And that is known as Bloom's taxonomy. So if you look at lower 2 levels, most of the verbs you told me, they are fitting there. We not discomfort level. We don't want to get away from that. You ask students, they want to go ahead. They say you ask us comment on this, comment on stages of 2 techniques in something. What are your views on that? That is higher level. But remember then we have to teach them also innovatively at the higher level. Then ask questions then. It's not suddenly you are trained somewhere and you start asking those questions. So aligning your teaching learning method with the domains and the levels of the domains is important to innovate on those components. Now we are moving immediately to the innovative method. You are aware of most of the methods. One is STL, self-directed learning. Everyone is using that. Or you have experienced that. You have experienced that. For example, which type of that was?
Divide the group and then give us a topic to learn and then explain on that.
Okay.
So related the teachers the topic and you have to give it.
You have some directions also.
Yes.
But most of the responsibility of your learning is with you. But somebody is still observing that one. We'll come to details of that. Flipped classrooms. You are using how?
So certain concepts which are widely available. For example, I'm from nutrition department, so setting up a diet clinic or something. So I asked the students to go and find out how it is there in all over the country or outside. And then we discussed it and then we made it into some activity based also later on.
Okay, so when they have learned about that, when they come back,
yes.
How they discuss? In small groups, large groups?
Yes, it could be small groups depending upon the categorization of the topic.
Okay, so here, flipped classroom I am talking about, this is very commonly used now. Many people use it. So we will not teach you innovative methods today. For example, I will send it reading material to Dr. Bhavna and she will distribute it. After 5 days you have a flipped classroom. Go through this reading material which is given to you about innovative teaching learning methods. After 5 days, there will be a 1 hour session on discussion of this article. You have read teaching materials given to that, and after that, on the day when you have your lecture slot, you are not taking lecture, you have flipped the classroom. Usually we teach and then discuss, but here we give the material before, they read on their end, and on the day of that slot, we discuss. So I will not teach on that day. Yes. So we flip the classrooms. They read first, then we discuss. Okay, that is flipped classroom. Very commonly used. And the response of students is very good on that. Wherever you involve them, they say it's good. That's simple. Case-based learning you might be using a lot.
Yes, sir.
PPL, CVL, that is a standard methodology. Integrated teaching you have started. Integrated learning teaching. Where subjects get together and so students don't get one particular in the nutrition, one concept goes for their full course together. You will not be teaching them separately. For example, anatomy, orthopedic, maybe there will be some one topic. So whole knee joint issues, disorder of the knee joints, you make an integrated module. People of anatomy also sit down together, decide what to start 1 year, 2nd year, 3rd year, which learning objectives of anatomy ortho will be addressed. You decide and plan together. But on the day of delivery of the material, any one of you can do it. You are integrating the topic, not the teachers. That is important. So that is integrated teaching. For example, in the medical now, 20% curriculum is covered by integration. So anemia is a module. There are 6 modules: hypertension, anemia, and others. We don't teach them separately now. Anemia is taught as a one long longitudinal section. Everyone knows what will be taught. Anybody can come on that day. If I feel that in 2nd year I want to show a physician in the class, which will stimulate them to learn pharmacology, I will call for that purpose only. It is not that the part I cannot cover and the person is good friend of you, call them. Just to show. Once they got motivated and they are at the peak of their motivation, then I will see, okay, these are the drugs, something like that. But it is already planned for full 5 years. And the university, one full question is on integrated topic. Remember that if you are using some of the teaching learning method, you have to align your assessment also. Otherwise, people will not come in. They say, okay, integrated class is okay, what should be, university question will not come. That issue is always there. Whatever is not assessed is not learned by the students. They are very clear about that. Whatever you do, say it will be part of internal assessment, this and that. They are very sure about that. E-learning. You have some learning management system. You have e-learning. Games or gamification. You are using that gamification games. Very common. Sometimes you start with the games only. And then in between there are learning opportunities. You have already planned and you have put up your information load there. And reflection writing. That students are writing reflections. You had some. Okay. So reflection writing is, for example, this full program is over FDP. Okay. You will reflect on FDP program. You will write 1 page on your reflections, which will not tell what was the lecture at all. That when you entered this FDP, you thought, okay, you will be sitting, people will deliver lecture. But when you came here, you really found this was very beneficial. You are already doing this, you want to do. Those are reflections.
We have it on LMS, sir, the learning management system. So it is not termed as reflection learning, but the process is there.
So there is a proper process for that. And then what they have written is teachers also need to read that. What is happening on that. You need not grade. Every assessment need not be graded. But that is reflection writing, which is used as a learning as a part of experiential learning. What they experience, they learn more about that. But they have really gone through that. So PBL, I think you're all the way right.
Yes, 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 sir.
I'm showing you two diagrams, PBL and CBL. If you already know about difference here. This is PBL. Facilitator, teacher's role is passive. This is CBL. Just projecting, just see if you can make a difference here. PBL, CBL. They are slightly different. They are not same. This is CBL. Okay, prior reading is there. You can see here. This is PBL. It is only problem. Scenario is given. Prior reading is not given. If prior reading is given, it becomes CBL. No prior reading, it is PBL. We will have a part of STL, self-directed learning. It means you give them a scenario, today this happened, that happened, some trauma to the knee and all. Okay. What will happen? So then they will go to next stage. Based on that, you will direct them to resources. Then the time is given. They are on their own. They are learning on their own. Based on their pace. Some are fast learners, some are slow learners. So they will learn on their own. Then again they come back, next session. Again more information is given. Then again they need more. CBL, you are giving that information. Prior reading is given. Reading material is given. About that. And then they go through that, columns are their clinical cases. So here facilitated role is there. So this is small difference. Since you are a faculty member, you are into faculty development program, this slight difference is there. PBL has many versions, CBL has many versions. People have customized as per their countries. That is perfectly fine. This is a small difference there. Flipped classroom. This is what I was talking about at that time. So, if it is visible, somebody will like to read the first paragraph. One person.
Students will first receive some pre-recorded videos, research material and references on the assigned topic at least 1 week prior to.
Okay, so they do something like this. They are on their own. Material is given, they are reading, doing, this is 5, 6 days, 7 days are there. Then in the classroom session, this is the next session. So there will be 2 sessions, sort of. One is on their own. You have given the material. Okay, that is only technical part. The session which actually happens is application of the conceptual knowledge shall be done through case-based learning or problem-based learning in a large class. When all are there.
Sir, what is the difference between case-based learning and flipped classroom?
What is the difference between case-based learning and flipped classroom? Anyone? Flipped classroom, I have a full classroom with me. Case-based learning, I will divide you into, for example, you are at 70, we will divide into 4 or 5 batches.
So you see how it's going to be good.
Yes, that is SGP. So each one will have a different facility. Here I am handling the whole class together. This classroom only I just flipped it. That is the only difference. Okay. You can do it this easily. There is no methodology involved, you don't need anything. Good. So maybe, as I told you exactly, you might not be aware of the names or something, but many of these things we are already using. A lot of innovation you are using it. But only thing in India, I think what is happening is we are reinventing the wheel. In India, I see every college, every university, many best teacher awards are given. Nobody has published till now why he is the best teacher. Right? If you, I'm just coming to you, if you publish why you are best teachers, others can also become best teachers. Right? But somehow that is not happening. Yes. Here the focus is, remember, flipped classroom, your focus is learner centered. Typical lecture, the focus is teacher oriented. Teacher oriented. So that is, these innovations are those innovations where you don't need large infrastructure. You can just next class, you can convert it to flipped classroom. You have one allotted hours, you are using that hour only. Just 1 week before you are giving material on that after 1 week my class is coming, that will be flipped classroom. So this is a material for it. LMS you already have, you can share the material there. So that way you can do that. So this is something which is very commonly used. And some of the things that you told me you are using, please publish your experience. Until unless they will not have any value. Keep on publishing. Right now India is publishing a lot in that, in the health professional education. So something like that, as I told you, first they go read on their own and then in a large room they are sitting. You are flipping the classroom. It's easier method and students' feedback is quite good on that. DOAP, demonstrate, observe, assist and perform, which is sort of practical demonstration where you want to reach the performance level. So that is done at that level. Simulations are used a lot these days. Are you using simulations?
Yes, sir.
Like in with what way? Okay. So where you are introducing simulations in that whole thing? Anyone? Where you are simulating something? Practicals. An example?
Yes, like I'm from the nursing and we are having simulating dummies. So there, like these dummies are they are showing, for example, the procedure of normal delivery students. So there is a simulation coming in from there. All the steps of labor is being shown in that dummy. So that is
One is mannequins. Mannequins are very synonymous with the simulations.
Yes.
You can use subjects also, normal subjects, to simulate. So that also variable, for example, mannequins, and nowadays variable patch is available. Variable tummy is available where the person is not pregnant, okay, not unreal.
They are also kind of the mannequins. They seems like a
So they are, because they will react like that.
Yes.
Mannequin maybe tell students you have to breathe. They go to the plastic mannequin, hello, how are you? But that doesn't looks like real. Okay, so when we want to make a real, here we are shifted to variable things. So they wear that thing. The person is the subject, so he will respond. Everything will be there. And then the realism simulate as close as possible to realism. Then the learning is more. IM injection, for example, IV injections. Mostly we use task takers. Part of the mannequin is known as task taker. If you're using only arm, gluteal region. These days again, but problem is that there you can't ask person, or have you ever had an injection before, allergic reaction. Okay. And so here we use a subject, variable patches are available. Okay. So you will palpate on the actual subject. At the peak of the injection, when you want to divert their attention away from other things, you are asking how many people are your family, then the needle goes inside. That feeling you get only when the subject is there. You are injecting into variable patch, but the subject is the person. That is simulation, which people need to use. So how real is that? Sometimes, so the basis for this is innovation only, remember that. Simulation is using the sports model known as deliberate practice model. Deliberate practice. So what do these people hide these days? High stakes games, UC cricket, lawn tennis, football. Each player will make videos. Maybe you are simulating something. So each player, they will make a video. Rewind it, okay, here is your mistake. Let's correct it. Then they work only on that mistake, improve it. Deliberate practice model. Same is used for deliveries, normal deliveries. All those modules are based on this. IM injections. We tell them, okay, you do this. So first is briefing. Whether it's a normal delivery, IM injection, we brief them on that day. A group of 15-20 students. They look at everything, equipment, everything is available, drugs are available, mannequins, what are the strengths, weaknesses which they are using, and then they actually run the scenario. They are given the time 7 to 8 minutes. That now the scenario will start, you are the team, you will handle this delivery or you will handle this person by IM injection. Roles are divided, start endpoints are told, they run the scenario. Here comes the role of subject or the mannequins. Then after that, this is over, we make a video of that whole thing. Nobody interrupts when it is going on. If they are doing something wrong, we know, but we just make video. let it over. After it's over, we sit down, we call this debriefing. So maximum time is debriefing, where they will tell what went well, how they will improve if they have to do it again. One take-home message, it is over. We never say fault-finding things. What they have done well, what they will improve. Second cycle is what they will improve if they have to do next thing. One take-home message each person. Debriefing gives you maximum learning opportunities. But as a facilitator, you have to be very, very attentive. Show them on the video where the mistakes, this has to be improved. You have noted down each person what they were doing. You are not teaching, remember. You are just picking up learning opportunities. So, any questions on this? It's very commonly used these days. Teacher's role is changing to facilitator. In health science, all health sciences, including some your sciences, I just came to know about it, background also. So remember that doubling time of knowledge, which was earlier in the years, is now into months. But I'm taking example of medical knowledge is doubling in 3 to 4 months. As a teacher, I cannot give all that to my batch which comes with me for 1 year. It means I should not struggle to complete my lectures that I have not completed this and that. We cannot do that. After COVID, earlier it was 3 to 7 years, then it was started. After COVID sudden, now it is 3 to 4 years. Vaccines were discovered in 15 years plus timeline. India discovered vaccine, new vaccine in 9 months. Things have changed a lot. So that's why we are talking about innovative methods. Use your role as a facilitator to guide them. Information providing is very difficult. You know, in a typical, when you talk of innovative methods, all these methods, sometimes you will be enthusiastic. You will have attended a session on teaching learning method, and you go back, you want to apply flipped classrooms. You as a teacher is very enthusiastic, maybe students are not at that time. Then the methods fail. When you burden the system with additional things, that's a lecture we will take, but flipped classroom also. If you have entered flipped classroom, remember, you have used classroom, then that topics need not be covered anywhere. Have confidence in your innovative methods. Once you have covered, all teaching learning methods are equal. If you look at students, lecture are lowest for them. For teachers, we assume if lecture is not done, it is not covered. That is not true. Some of them who are short in attendance, supplementary batch and also. Remember, you have not taught them, but still they pass. So look at that. Your role is needed as a facilitator in most of the newer teaching learning methods. In fact, there are courses in simulations which train you as instructors. We by default are not trained as instructors. Okay? So if we have to go into this area, we have to be trained in facilitation skills. Okay? We most are typically trained as teachers. That too we have seen our seniors and assume that is our role model. Without having awareness what is a good role model. Then after 5 or 10 years you will realize कि गलती कर ली. So that comes back. Remember, innovation, when you are trying to see, first you should also be knowing in your setup whether this is possible or not. Some innovations in a particular setup, infrastructure and region will work very good, in others it will not. Good skill labs you have, then simulation is something which you will use. We are looking at that earlier normal delivery. Like I have learned normal delivery on the patients at that time. Okay, number of hospitals are very less. We used to deliver 5, 6 together was there, and you have to run here and there. These days clinical material is not. Number of medical colleges. As of today it is 780. At that time it was 200 or so. So you can at medical colleges nobody goes for normal delivery. It's a referred cases. So you struggle to see. So we are shifting to show the students steps of normal delivery, then show a video, then they do on a dummy simulation plan, simulation actually they do. Then we sit down, we tell okay what mistakes they have got different. Then we assume tomorrow in the ward, in the OT ward, they will be able to deliver that. Transference of this learning. But we have added 3 steps now. Earlier we used to teach them, these are the steps and now go to the patient. This is delivery today, you go today there. Now, then after that, they see a video. They can rewind it, go forward, see which steps they are missing. Then they actually do it on a dummy, make mistakes, correct them, then go to the patient. So now the research says with this, what has happened? Patient safety has improved. And patients do not allow students to touch them by these days. After COVID, we are real dilemma. Earlier we used to say why we are using dummies. India has so much of patient clinical material. After COVID, we have shifted to these simulated patients. Both ways there are issues now. Any questions you have on simulations? See, students, this is one of the study with one of the organization, this is commercial organization. Lecturer name you might have seen about that. So this is your students are already 75% are using mixed course content. 15% attend traditional lectures. Many places attendance, even in AIMS, it is not compulsory. All AIMS, attendance is not compulsory. You want to go, you go. 90% are using video-based learning resources. Most of them has apps. They are bots, system. Many are available. I think in your field also they will be available. And students find they are more engaging. In fact, many courses are struggling that they are not coming into classes, but they are subscribing to content, other contents which are available. Okay. It means what is happening now? There is a competition between teachers and the softwares. They don't want to sit in your classes. And as a teacher, have you gone to that software and see what is difference in what you teach and what is in the software? You will be surprised to see.
There is a 3D learning.
3D learning. What else?
And the more analytics part.
Yes. What else?
They find it more challenging.
Yes. What else? Very correct.
And it's student oriented, it's not just a lecture, it's a boarding, but it's a two-way discussion.
They can stop it also a bit and have some questions also. Assessment drives learning. Remember, these days we are not using assessment for of learning, but assessment for learning. That is a change, major change. And what they find is most of us teachers, see, we know a lot in our subject. They say for their requirement, if they are undergraduate students, they say our requirement is this much knowledge. You are full of knowledge. When you come in a lecture, you want to tell everything so that we gain from your experience. They say we don't want that. Yes, exactly. So what usually we do in 1 hour lecture, they learn in 20 minutes.
The problem is with the videos and the lectures, they create an environment.
Yes.
Which we are unable because we are not having that 3D pictures and all that. But with the videos, they make our environment force, they make them interested towards the topic.
Yeah. There's still, even today's year, there are some colleges and institutions where I have heard from the students that they are taught so well, so many assessments are there, they are not going for any other subscriptions of this sort. It means if there is a demand we are not giving, they will go to that. It's simple demand. They need something, it is not available in that institution or university, they will go outside. They are competing directly with us, remember that, all these softwares. And you know who makes these softwares?
People like us.
Big people like us. They have left the jobs in the universities, they are working with those applications.
You make the audio visuals more interactive, so that they can understand the one person, they see what they're listening and they see the process.
More, because one-to-one interactions. Your queries are solved, and you can learn at your pace.
And you can sense and feel it, like with the visual representation.
But is it very difficult to replicate in your universities or classrooms?
Time
Why the time is a constraint?
because there is less amount of time in which we need to cover a lot of syllabus.
We cover the syllabus. That is one of the issues. Do not try to cover the syllabus.
It is mandatory.
I tell you about that. So at the SGD you have put in one topic, it means that is done. No need for a lecture. In that way. We say the typical thing I told you, till we have covered in the lecture, it is not covered.
The students that did not find it
pass after the class, that particular batch has passed out from your subject, then you take a feedback on lectures. You will be surprised how many actually apply, on which we focus so much. Right? You will be surprised. Beautiful, your slides might be beautiful, you have animated, you have used all principles of interactivity, okay, and the attention span. Still there are issues. If we can address the learner's need, that's why I told you, curricula has changed most of the sciences to competency, which is learner oriented. Now there is a bar on the number of lectures. They can't take more than that. They were studying. For example, in one subject, the bar is 80, they were taking 200. People are full of knowledge. Parkinsonism, there is one competency, you need 1 hour or 2 hours. One particular institute was taking 10 hours on that. Look at poor MBBS students. So that they have become totally close to you. मैं भी ये कर सकता था बहुत सारी स्लाइड्स बहुत बड़ी बड़ी लेके सुंदर लेके आता, लेक्चर की डेफिनेशन दिखाता, फिर कुछ लोगों ने रिसर्च किया कि व्हाट इज द डेफिनेशन ऑफ लेक्चर, हम वो भी डिस्कस कर सकते हैं। और मैं बोलता जाता वहाँ खड़ा होकर बोलता जाता 1 घंटा, बट वो आपकी नीड ही ना पूरी होगी। Especially for me, coming from that background, your background is mixed background. To align this thing is very important. So we should cater to the audience, what they need. Do not try to cover. Possible nahi hai. There are so many things coming up, information load which is there. So it's very difficult to compete with that component. Student for PBLC, we don't cover the things. Just tell them, okay, this is scenario we are starting. Now the ready material is available here. So then they go there. So I don't know how many of you use digital resources. You use digital. How many of you are using? Hands are less now. Let's do small exercise here. We will use a digital resource now. Open your phones. These days to the learners we are allowing the use of different things which they have. There is an app, Socratic, S-O-C-R-A-C. Socratic app.
Comes up.
You will log into Socratic student. Do not log in, just go to Socratic, download it. It will take few seconds only. Socratic student, just wait there. In front of you, I am putting this question there. I have logged in as a teacher. You don't have to log in. Wait. You are ahead of me, right? You see a room number typing space? Type 65, room number 65.
Join.
Right? I'm coming back to the choices now. These were your choices. That have you ABCD? ABCD you have to respond. Yes, no, partly, not sure. Have you used digital resources in teaching till now? You are responding as a learner right now. I'm taking away this screen now. 65. And type into your response. You can see your live responses here.
Next question.
You can see your responses here. Here I have logged in as a teacher. So 55 of you out of that, 50 have answered. 55 are logged in, 50 have answered. So what I can do is with this, why I am doing this, I am using this as a teaching learning method. I am showing you your response to that, because otherwise I was not able to watch. Some was raising hands, some was shy also. But here everyone responded. So I have not shown your names, otherwise what we do is students can log in, their names also. Now based on what message I want to give in that session, I want to tell them where they stand, I can show them their room. But if you want a general question to see where the whole group stands, I will show you group information only for groups. So what the innovation is that use assessment for learning. We call them AFL these days. Use assessment opportunities are a lot. Use them for learning. Do not make always it as threatening. You will take these marks into this and that. So use a lot of that. This you can actually innovate in each of those components which we are talking about.
So we are using like Kahoot and Mentimeter software.
Yes, Mentimeter. Mentimeter has a lot of options.
Yes.
Sometimes people just use it to show okay how it comes, flashes on the screen. Lot of ideas go away. But remember, that's how, now we are coming to that. Digital teaching or e-learning is not just choosing some material available online. Till you have connected it with the learning, this doesn't become e-learning. Then it stays as something which is available online, but not learning. It means you will totally design a module where you see what are the learning objectives today, where I will use this digital resource. Then again I will shift to debriefing or learning. Otherwise, sometimes you get so much fascinated by these things. Okay, Mentimeter, you see this, but you don't remember anything later on. The learning doesn't happen. There are many fashionable software, small, free things are also available. But remember, if learning is not happening, we are missing that. That is very, very important. Okay, these are the avenues where we can use digitalization. Knowledge, skills, attitude, all parts, practical teaching, common teaching, everywhere it is possible in education. And I'm just showing you some of the experiences we had with our components. Even during COVID, we used a lot of digital resources. Online classes are not allowed right now in our curriculum, but we use digital resources in physical classes. Remember that. This is slight difference here now. We are talking about e-learning or use of digital resources in physical classes. Okay, that we continue to use now. A lot of these things we use. Videos we make. For many of the teaching, sometimes you go to YouTube to download videos. Make your own videos. We have so many good people in India. They can do role plays very well. Get it copyright. Copyright in India costs around 500 rupees, government of India. Right? Then you allow everyone to use it. Once you have copyright, it doesn't matter. It is in your name. Small things. You are doing innovative teaching, but you are not copyrighted. Somebody else will do in the coming days. All these innovations need to be copyrighted. So all these things are available. Many things are available as a case construction. One of the major issues, many cases which are available on these learning management systems are from other countries. The moment you open, you find those dissimilar names, scenarios not meeting our requirements. The acceptance to the learner doesn't come. We had a lot of feedback from the students. We also work with many publication houses who are making these softwares. We told them, use this and they tell us that we have sold something in 40 lakh rupees prescription per year. but in the whole university, 5 people have used it. Because the issue is the moment you open all the pictures, all the scenarios are other countries. You do not find the relevance. We have so much of rich diversity and things available. Only thing is we need to convert them into cases, which look like our scenario which we have. Then we can do more work. SDL. So SDL is a specific method now. I'm coming to that. It is used in many places. We are using it online. We have used it for ourselves also. So this is a method where a lot of thought had gone into that. We have worked on a lot of methodologies. One of our methodology is being used in India and other countries also now. Process in individual takes the initiative with or without the help of others in diagnosing their learning needs, formulating learning goals, identifying human and material sources, choosing and implementing appropriate learning strategies, and the learning outcomes. Here, student decides what they want to learn. You know today's this is learning intellectual competency or topic. After that, students decide about that with the help of some other people. Resources you later on tell them where to go for that. So, to plan their own learning, to develop thinking and learning, to develop problem solving skills, and independent global learners. We are looking at people. I know your people are not going outside countries also. Boundaries of learning now. But we want the students to be taught at a similar level. That is happening now. Reverse trend has started already. So SDL started in various ways. For example, this is one of the ways. The theory behind this is stage 1 is something interactive lectures, student become interested. Stage 1 is simply didactic lectures, maybe first year students. They come from schools in India. They are dependent on a lot of spoon feeding. Immediately we can't wean them off from that. So slowly, stage 2, maybe second year, interactive lectures, third year, small group discussions, fourth year seminar, which they prepare with the help of faculty, moderators. Independence will keep on increasing. Now in our curriculum now, some hours are only dedicated for SDL. Where something what happens, you tell, okay, SDL, we have curriculum mein likha, people don't do it. In our curriculum, every college has to put timetable, full manual 1 year. When is SDL, what is the topic, what will be covered in each lecture, competencies are having numbers. So those are written there for full year for each subject. So we have to write how many SDLs are conducted, which is given minimum as per admissions. Okay, so then they will use these hours. Each year it is there. So it goes on like that. Conducting SDL, what happens? We have to train faculty. This is not a method which people are using regularly. This is a part of some other methods here and there. But people once are not sure about what is SDL, so its use was very variable. Right? In one place, a student has given a definition of SDL. We asked another college. We conduct workshops in many colleges throughout India and Southeast Asian countries. So we asked them, the student described beautiful definition. SDL is where someone comes, gives a topic, and then goes off. Then someone comes after 1 hour to take attendance. See, remember, if things are done like that, their feedback also will be like that. So that was happening a lot. So faculty training is needed for committee. Topics are selected right in the beginning. Which topics will go not to lecture but to class. Resources, formation of online groups, this is all done beforehand. I'm coming to a typical conduct of 1-2 hour SDL session. You also have 1 hour slots for teaching. 50 minutes slots. So first 50 minutes they will come. The topic starts. You have aligned one topic. 10 minutes is instructions to small group. Who are we today? For example, let me take this is a small group today. Okay. And we will talk to each other. Okay, what is your name and all that. I'm your facilitator for today. That will happen. 20 minutes, I will tell them today. Learning objective competence is already written in the schedule. I have brought today a trigger, which can be video, paper case, LMS case, something like that, which I have WhatsApp group is made, I am sent to them. They start their discussion on that. I am sitting there out of the circle. Out of this group, one person will be the leader, one will be the writer, one will be the timekeeper. That is told to them in the instructions. I am out of the circle. For the same topic which is there, I have the learning objectives with me. This is called as facilitator guide, 1 page or so. I have also resources which are to be given at that. Everything is given, and all the facilitators who are handling different small groups have the same facilitator guide. The same guide is everywhere. So when they start discussing whatever they don't know, the writer will write on a board as learning issues. They will keep on generating learning issues. And in the end, if in between I find they are doing off the track, I wanted to focus them more on the drugs, but they are going more into management, then I will intervene in a subtle manner to bring them back to the mainstream. That is my role as a facilitator. I know the learning objectives which are needed to complete this competency of the topic. Okay? So at the end of that 50 minutes when I am going close to that, I will say, okay, just read them again. See, do you all agree to these learning issues? Write in a better handwriting and with the proper verbs that you want to scribe word or to numerate only, so that everyone, when you are next week, 1 week, you are now going into STL period. This is part of the STL period, session 1, but this is a technical session. Teachers have not taught them. Right? They have discussed generated learning issues. After that 15 minutes, I am giving you a list. I have sent on the WhatsApp. Sending you a list of resources. Next 1 week, you will go through these resources at your ease, whenever you feel like. And I will also contact you once or twice in the week to find out, number 1, whether you are able to access the resources, any difficulty you are getting. Number 2, if you are got the resources, are you able to read, any difficulty you are getting. That is my role in that morning. If you are see most of the depth of 10 hours in a year, 10 hours means 5 topics. There are 2 sessions. So 1 week they are on their own when they are attending other subjects also, other things also. Whenever they attend, they have read through. I made sure everyone has gone through the topics. And you are free to contact me anytime. So those instructions are also given. After that comes the last session. Next week, same time, usually we here, same time, next week, same slot is STL, session 2, block 2. They come back, everyone has gone through the learning issues, now there is a debriefing session, which goes for 30-40 minutes. They now have read through that, they discuss again those learning issues. They are not read, unread because I have checked them, that they have received sources, they are able to go through that. Now they are discussing that. I am there in this period, which is called as debriefing. I will get many opportunities to reinforce their learning where they are correct. Where they are not correct, I will do corrective feedback. That is my only role as a facilitator. This is block 2. Technically, we end this topic here only. But STL is infinity. You will have more issues, you can generate and keep on reading. That happens with us. You have to take a new section for faculty. How you prepare yourself? You have to take 1 hour session on innovative teaching learning methods for your subject in your department. How you prepare yourself? Which resources you go to? Anyone? Yes, ma'am. Internet is one, yes. Books, internet. What else? Innovative teaching learning methods. What can be your sources? Case videos. You can even talk to seniors. Those are also resources. So it can be internet, physical books, libraries, people who are experts. Many resources can be there. But here, if you just go on to internet, you have 2 days. You have collected so much information on the internet. Was there a PDF, PPTs? Which one do you use?
Libraries are something which we need more open.
But your issue is after 2 days you have a 1 hour session with faculty sitting now. So how you will manage those resources? किसको पढ़ना किसको नहीं पढ़ना? How you will decide that? Is all okay. Health issues. In postgraduate studies,
Bedside teaching was
like undergraduate was their lectures and they will say okay today there's this class that class.
starting, for example, we used to visit clinics and we used to see the patient. Then we used to come.
Nice
And then they
storage.
ask what you have learned.
So when they ask where you are going to read that, what they will ask.
So it has started with observation. For example, they ask us to make a assessment program.
You know today you are going to what they are going to ask this. At PG level, how you are preparing yourself for those questions.
How I was doing the practical on the patient. For example, the patient is on stroke and I'm checking the sensory. Then they used to say that okay, the sensory is coming.
So before checking the sensory, you need to have some knowledge about that. How you are reading.
Drawing the bachelor's to us.
Okay. Yeah.
I think for when our consultant used to come, before he's coming, we need to know the whole history. Their whole assessment, अभी तक जो भी हुआ है इसका.
So it means in the postgraduate, what you told me, they were asking. Were they teaching?
No, they were teaching also. For example,
And knowledge part. Correct तो कर दिया पर उन्होंने आपने गलती की जो उससे पहले आपने वो कहीं से पढ़ा होगा ना जैसे undergraduate तो they will teach you a lot. They will teach you a lot. Go on with many lectures. In postgraduate, what there are some dedicated teachings by the faculty, or you are learning.
we are learning. We have a patient from patient.
You are seeing, observing, and how from where to learn. Who was guiding you for that?
Our teachers they used to brief us the thing. Okay, this one of the points when you go, आपको ये चीजें वहाँ पे introduce होंगी.
And
Look into this.
did it tell you where to read those things?
Yes. Even name of the books, the articles, everything.
So in the postgraduates, there will not be a definite schedules for teaching the students. Remember that. This is mainly like self-directed learning,
Yeah.
where they will direct you from where to read, which resources. Now you have become faculty. When you have a need to learn something new, how do you do that? So undergraduate हो गया, lot of teaching was there. Postgraduate you were sometimes guided by the guides or supervisor. And at faculty level,
Research articles.
how you operate yourself, you read yourself.
Research articles.
So now we are talking about SDL. SDL starts from the undergraduate, where it is very less. Postgraduates in the case is more. Faculty level we are totally dependent on SDL. But remember, direction is bigger. Otherwise, what will happen? I will collect many papers. Sometimes workshop like this we go, we take photos of each slide. उसके बाद कभी आपने उनको खोल के देखा दोबारा से? So we collect a lot of resources. We don't know which one to read. There you need that deep, directed learning. Somebody, a facilitator who tells you which resource is good for this. Hand washing, COVID, go to so many modules are there. This is my module is better than. अब आप जाओगे तो वहाँ पे तो I think more than 2,000 modules are there. Which one you will choose? How you will decide? Suppose you have to decide in university one hand module and washing module. Which one you will choose? Content. But 2,000 को आप review करोगे. Okay, you are looking at some directing agency now, where people have already reviewed. Means some facilitator is there. Otherwise, you will be lost in the world today. So many resources are there. So at our level, our self-directed learning is at the highest level. In undergraduate, it starts building up. But when we were students, nobody told us about these things. Now, if we know in undergraduate only, we inculcate that. But covering few topics by this method, we inculcate self-directed learning skills, which are also known as lifelong learning skills. in our students. But now we are telling them they need to have these skills. Otherwise, some of have these skills, some of them even don't know these are skills. So as such, SDL is not a method which will give you more marks than lecture, but it will add to your lifelong learning skills. So every method, innovative method, has some advantages. Remember that it is not the marks, because many times your administrators will ask, okay, you have started something new, are more students are passing? His percentage has increased, his restrictions are more. That doesn't happen. Remember that there are some additional advantages which you get out of. So SDL will tell you, for example, we have taken this slightly more time on this. This tells you about self-directed learning skills or lifelong learning skills. So teachers' role is mainly facilitator. We had a lot of in-depth discussions with various medical colleges and other health professional education students about this throughout India. Students have become very clever. You know that already. The way each department assesses and teaches, they have made their own set of things, how to behave, how to do that. So they say, sir, we know in SDL, we have to read on our own. This is based on the demand of the students, which was given during the curriculum revision. They should be treated as a dead learner. Some responsibility of learning should stay with the learners only. See, what we do in the SDL, we try to motivate the student. Hey, sir, you watch a teacher. हम टीचर को इतना मोटिवेट करते हैं, दे स्टार्ट टेकिंग अ मिनी लेक्चर. तो जो हमें पढ़ना होता है सो वही हो जाता है. We as a teacher, sitting for 50 minutes in a class not speaking, you try, it is not easy. आपका inherent teacher बाहर आता है. You will try to teach them, आपको पता है, आपको रोकना बहुत मुश्किल होता है. I should tell them this, but वो नहीं होता. So you don't make it a mini lecture and give them information load. That is, otherwise they will never learn. Lifelong learning skills. So remember that this method, apart from covering a topic, we are making them competent in lifelong learning skills. To act as a facilitator is very difficult for most of us who are typically trained as teachers. So that happens. So you need to get training for that, remember. Get any course where they tell you the facilitator skills. Okay, so that is needed. Lot of methods are there after SDL, how we assess and how we evaluate. In these all teaching learning method, two terminologies are there, assessment and evaluation. Both are different. Assessment is not synonymous with the evaluation. Because you will be using teaching learning method to innovative, people will ask you, what is the difference? Is this better than other? If you have to tell one teaching learning method, compare with others better than other, you will use assessment or evaluation. When we add a value to a program, we say evaluation. Assessment is typically student assessment. When you are looking at a program like SDL program or faculty development program, we use evaluation. Assessment is, that is a distinction. Okay? Within the evaluation, assessment can be part of. Many assessments of whole year can be done before doing that. Okay, so that comes. This is one module which we are using, which is known as ATCOM, Attitude, Ethics and Communication. This is a 4.5 year method. Here even they have given which methodology do we use. Exploratory session, facilitator panel discussion, everything is given. Accordingly, this is taught by multi-subject teacher. This is not a single subject thing. Attitude, ethics, communication starts from day one of the medical school, goes till the last year. So something like that, where the methods are given, duration is given. So now things are more defined, you can see. And this is strictly to many other sciences also. What to do, how to do, how many hours are there. So choosing appropriate teaching learning depends on the domain, group size. We have discussed that. Resources available in your institute, your university. That is important. Time frame, how much time frame you have, level of learning, you have to align with that. Coverage of subject which you are doing. So all so many things are there. Based on that, you will select your TLM, teaching learning methods. So in short, no single best method. Lectures are not the best methods. Ask students. Look at your own kids. They will tell you real things. What they do in the lectures and all. Right? So many students tell this is a real thing. They said, sir, we ask them very freely, telling them names will not come and all. These are when the teacher switches on the PPT, we switch off our minds. Or they do their pending work. So many things are. So try your own. There's no end to innovation. You innovate. What you think suits best to you. It is not that forcefully you have to do flip classroom. Out of there something you like, you use that. Give it a new name, you make it a new method. All methods have come like that. Now many methods are coming fortunately from India only, because we needed that. So we'll stop here. We can take some questions if there are. What questions you have? Any additions, comments, or reviews?
Sir, is there any time frame for the FDP? Then
Yeah.
we have to complete one session and one.
Usually 2 blocks.
2 blocks.
2 blocks for one topic. So you have 10 hours, we take 5 topics.
Sir, I would like to share something.
Yeah.
It was a wonderful session. I really enjoyed it throughout. And I was very happy to see that before COVID, when these innovative methods were not so much into the picture, I was working with UNICEF, and there we have used the simulation and the SDL for the ICF and early initiation of breastfeeding to the MOs and ANMs, and it was a wonderful experience, and I can relate it how we use all these techniques and today how it is there only now.
In fact, what happened, COVID came in March 2019.
Yes, yes.
New MBBS curriculum was released March 2019. 22 years after MBBS curriculum was changing, everyone got geared up, everything was made, and the COVID came. But people responded so well in India, they devised so many things. We were teaching clinical skills online.
So I am talking about 2016, 15, 16.
So what happened after that? I'm telling you that relation to that only. After that, so many things came from India. They have now become part of teaching learning, digital resources. Before that, there was a lot of resistance. Okay, most of us, I think, first time went to Zoom. And how did you learn to operate Zoom, take a class on Zoom? Because there was nobody to teach, you can't contact. How you learn to take your first class on Zoom? YouTube. Or
Here we have a software blackboard.
but we were not coming, physically nobody was there. Nobody was even
So
connected.
ChatGPT.
Some facilitator was there.
Yes.
STL.
So SOPs were shared.
STL happened at that time. Remember, we are at the faculty level, so it was easier to adopt. STL happened for hand washing in the home, vegetable washing, lot of other things. That was STL. So there's a typical, I have not shown you the concept behind the STL. There's an immediate adaptation and there's a long-term adaptation. Immediate adaptation of the STL during COVID time was hand washing. Are you washing hands more now?
Yes, yes, sir.
Okay. Long-term is you have learned to avoid many things now.
Yes, sir.
Okay, that's a long-term adaptation which has happened. So STL has a long-term implication which happens slowly. Any other inputs or questions?
Thank you everyone for your active participation towards the session. On behalf of UHS, I extend my heartfelt gratitude to Dr. Dinesh for his invaluable contribution on this program. His insight and expertise will definitely inspire us, our thinking, and redefine our teaching methodology. Now I would like to request our HOD of Forensic Sciences, Dr. Sai Sharma, to kindly come forward and present the token of appreciation to Dr. Badiyal.
Thank you everyone.
Thank you so much, sir.
Thank you.
as we bring today's session to a close, let us reflect on the transformative insights shared by Dr. Badiyal. His emphasis on innovation, collaboration, and adaptability serves as a guiding light for the educators seeking to make a significant impact. A special thanks to our key coordinator, Dr. Bhavna Turkal, for her exceptional efforts in organizing this program, and to all the participants for their enthusiasm and engagement. We look forward to seeing you in the next session, and I would like to recall again that please scan the QR for your attendance and feedback. Okay, thank you so much for being a wonderful session, and thank you so much for your presence. We are really enjoying. Thank you.
अब क्यों बैठे हैं चलिए